on the thorax, lungs, and breast and the heart of the patient. Good morning, I'm Christine, your student nurse for today. Can you please verify your complete name and birth date for me? How would you like to be called? Okay. Thank you, Mr. Tony. That was just to ensure that I'm speaking with the right patient. So today, Mr. Tony, we'll be conducting an assessment on your thorax, lungs, breast, and heart area. This is to check for any abnormalities, and all significant findings will be cascaded to your doctors for the treatment plan. So, I'm going to perform an EKG. Mr. Tony, I might ask you to undress for me and change to hospital gown for EC assessment later on. So, do you need any help in changing? Okay. So, for these random video purposes, the patient does not need to undress during the assessment. So, to begin, I'm going to assess first the posterior thorax and lungs, and I'm going to stand behind the patient and expose the patient's back to inspect the color, the chest symmetry, and respiration pattern. So now I'm going to check the color, the chest symmetry, and the respiration of the patient. Patient's skin color is brown and chest is symmetrically equal. The respiration rate is 18 cycles per minute, even and unlabored, which is a normal finding. Next, we're going to perform palpation to check for temperature, tenderness, and masses. Now I'm going to check the temperature using the back of my hands. For the tenderness, patient's skin is warm to touch and no pain or tenderness elicited and no muscles palpated. And now we're going to perform the tactile fremitus. So we will be using the ulnar edge of our hands and position it on the patient's back. And I'm going to ask the patient to say 99 for the vibration. So, Mr. Tony, when you feel my hands at the back, could you please say 99? Okay.
99, 99, 99, 99.
For the findings, the vibration is decreased over periphery of lungs and increased over major airways. Next, I'm going to perform thoracic expansion. And I'll be positioning my hands and at the level of the patient's 10th vertebra, and I'm going to ask the patient to take a deep breath. Sir Tony, when you feel my hands at your back, I want you to take a deep breath for me. Is that okay with you? So for the findings, there is 3-inch symmetrical thoracic expansion, which is normal. I'm going to assess the diaphragmatic excursion to determine the level of diaphragm. So I'm going to ask the patient to exhale and hold it, and I'm going to percuss starting from the bottom of the patient's back and look for any dullness. Then I'm going to draw a line as to where you can elicit the dullness, and I'm going to ask the patient to breathe normally, inhale and hold it for a while. And I'm going to draw a line as to where you can elicit any dullness. So, Sir Tony, I would like you to take a deep breath and exhale and hold it. Okay? So, take a deep breath, exhale, hold it. And I'm going to mark it. Now, I would like you to take a couple of normal breaths and take a deep breath and hold it in. Okay? So take a couple of those breaths and take a deep breath and hold it in. And I'm going to mark it. For the findings, The distance is between 4 centimeter, which is normal, and there is no presence of resonance. Now I'm going to auscultate for breath sounds, and I'm going to observe any abnormalities such as diminish and absence of breath sounds. I'm going to auscultate for the pleural fiction rub, wheeze, and the crackles, and I'm going to auscultate for voice sounds over the chest wall, and I'm going to assess the lung periphery, the bronchophony, the whispered, and the egophony. So, Sir Tony, I'm going to assess your lung periphery. So, when you feel the stethoscope in your back, I want you to take a deep breath for me. Is that okay with you? Now I'm going to auscultate for the bronchophony. So, Sir Tony, when you feel the stethoscope at your back, I want you to say 99 for me. Is that okay with you? And now I'm going to assess the whispered picturology of the patient, and I'm going to ask the patient to whisper 99. So, Sir Tony, when you feel the stethoscope at your back, I want you to whisper 99. Is that okay with you? Okay. And now I'm going to assess the egophony, and I'm going to ask the patient to say prolonged E sound. So, Mr. Tony, when you feel the back of the stethoscope in your back, I want you to say the prolonged E sound. Is that okay with you? Okay, thank you. So, ready? 1, 2, 3. For the findings, as I auscultate the breath sound of the patient, I haven't observed any abnormal sounds such as crackles, wheezings, and pleural fiction rub. So now I'm going to assess the anterior thorax and lung of the patient. So first I'm going to inspect the color, the chest symmetry, the respiration pattern, shape and position of the sternum, and the chest expansion. The anterior part of your lungs, is that okay with you? So I'm going to check the skin color of the patient, then the chest symmetry, the respiration pattern, the shape and position of the sternum, and the chest expansion. For the findings, the patient's skin color is lighter than the anterior part of the posterior part of the patient. Then chest is symmetrically equal. The respiration rate is 18 cycles per minute, even and unlabored, which is normal. I'm going to palpate the anterior part of the patient. So I'm going to check the temperature, the tenderness, the masses, and the position of trachea. So, Mr. Tony, I'm going to palpate the anterior part, and I'm going to check your temperature, the tenderness, the masses, and the position of your trachea. Is that okay with you? Okay, thank you. So, to check the temperature of the patient, I'm going to use the back part of my hands. So, now I'm going to check for the tenderness. Then I'm going to check for the masses and the position of the trachea. Okay, thank you. So for the findings, Patient's skin is warm to touch and no pain or tenderness elicited and no muscles palpated. I'm going to assess the tactile firmness of the patient and I'm going to use the ulnar edge of my hands. So Mr. Tony, when you feel the edge of my hands, I want you to say 99, okay?
99.
Now I'm going to check the thoracic expansion of the patient and I'm going to put my hands on the 10th vertebra of the patient. So Mr. Tony, I'm going to check the thoracic expansion and I'm going to put my hands on the 10th vertebra. And when you feel my hand, I want you to take a deep breath for me. Is that okay with you? So for the findings, for the tactile firmicus, the intensity of the vibration is equal to either side. And for the thoracic expansion, normal distance from the other thumb to the other thumb. And now I'm going to percuss the patient and I'm going to use the middle finger and my dominant hand to percuss. So Mr. Tony, I'm going to percuss your chest and I'm going to start with your clavicle. Is that okay with you? Okay, thank you. And I'm going to follow the same pattern. So for the findings, there are no signs of any resonance. Next is I'm going to auscultate for any breath sounds and I'm going to observe any abnormalities such as diminished and absence of breath sounds. And I'm going to auscultate for the crackles, the pro-friction rub, and the wheeze. I'm going to start with the trachea of the patient. So Mr. Tony, I'm going to auscultate your trachea. Is that okay? The down periphery of the patient. So Mr. Tony, I want you to take a deep breath when you feel the stethoscope on your chest, okay? Next, I'm going to assess the bronchophony. So, I'm going to ask the patient to say 99. So, Mr. Tony, I'm going to assess your bronchophony and when you feel the stethoscope on your chest, I want you to say 99. Okay?
99.
Next, I'm going to assess the whispered pictorial acuity of the patient. I'm going to ask the patient to whisper 99. So, Mr. Tony, I want you to whisper 99 when you feel this stethoscope in your chest, okay? I'm going to assess the gophony of the patient. I'm going to ask the patient to say a prolonged E. So, Mr. Tony, I want you to say a prolonged E when you feel the stethoscope on your chest, okay? So, for the findings, as I auscultate the breath sound of the patient, I haven't observed any abnormal sounds such as cracks, the pearl friction rub and leads. Next is I'm going to assess the axilla and breast area of the patient. I'm going to inspect the size and symmetry, the shape, color, the skin surface, and the presence of any discharge. Mr. Tony, could you please put your hands together? Okay. Could you put your hands on your hips? Could you please put your hands above your... Okay, I'm going to check your axilla area. For the findings, the breasts are even with the chest wall and kind of similar in shape to the female, and the skin is uniform in color, similar to the abdomen of the patient, and there are localized discoloration or hyperpigmentation, and the nipple is in oval and bilateral, and it is dark brown, it is round, everted and equal in size, and both nipple point in same direction, and there is no signs of any discharge. And now I'm going to palpate the axilla of the patient. So Sir Tony, could you please put your hands like that po? And I'm going to palpate your axilla po. So for the findings, there is no tenderness, masses, or nodules upon palpation, and there is no signs of any discharge on the nipples. And now that we are done in assessing the patient's lung, thorax, and breast of the patient, I'm going to perform hand hygiene. Alright, Mr. Tony, I'm going to assess you to replace your hospital gown to change into your clothes, okay? Then, document the findings. So, Mr. Tony, I already document the findings, and rest assured that all these findings are kept confidential, and I'm going to cascade this to your doctor for the next treatment plan of action, okay? Thank you, Mr. Tony. Have a good day.